Not the species, not the species. We are not able to.
I am different, you are different, height, weight, problem is different, and require millimeter by millimeter correction. This is what it makes it very easy. It's a scans and creates the arch of it is the arch problem, higher bar. Then we use the design to 3D printer will print the customized insoles and shoes. For example, if you give me your sports people.
So only soles?
My leisure time, I do one after another assignments. They teach, they give assignment, and this is an indirect way, an additional way of learning for tomorrow. You are tomorrow's doctors. So learning is essential and dynamic. Please utilize the platform. It has been devised by NIHFW, by the MOHFW New Delhi, and Dr. Dharmendra Yadav is handling the platform dashboard as well as the materials. Now, taking you to your knowledge that net5g.org and PM Divine are also the initiatives which are for adoption, because the healthcare professionals may not reach the rural population because of the distance and the challenging situations, but by the telemedicine as well as e-Sanjeevani. Please look up, my dear students. You are tomorrow's doctors. So with these platforms, we can reach them as well as take care of them. And this is indeed an opportunity for us, because we are learning so much. We are interacting with the people who have done it, who have already implemented in a few other states of Northeast. And we can also think of having it so that we can reach up to the last person in Nagaland, in the last district, in the last village. So nobody should be left out, because health is a right, and we must take care that we are providing it to the best. We should be sincere enough for that purpose. Next, I would like to, in my welcome address, I would like to highlight that there are SDG gaps. 2030, by 2030 it should be all united and integrated, and there are organizations who are working towards it. NIMSAR is also a part of it, and being a medical college with holding the hand of Directorate and Secretariat and the rural population, and also the utilizing the opportunity of family adoption programs touching upon the villages, we will be delighted if we can narrow down the gaps, converging the deficits, reach the goals, and be one of the pioneer in healthcare services in India as well as globally. And I really appreciate the effort of Ampton, which can take part in Antodaya vision of GOI. And this Antodaya vision is very important, that, please read it up if you don't know, that by the PM Divine, by the Ayushman, by Viksit Bharat, this is another vision which will take us to the rural population, to the districts, as well as for handling the challenges, healthcare challenges and mental health problems. Therefore, the aim of India is healthy individuals build healthy nation. Now, with this closure of my welcome address, I welcome you all, and I am sure you will be participating the whole day in this workshop. Learn, implement, and enlighten yourself how we can digitalize, and how health can be reaching the challenging situation. If you have read today's newspaper, the most important news was in Ontario, there are only 500 slots being given in Canada. Only 500 slots have been given, and there are thousands of people waiting in the line if they get a slot for healthcare. So let us not be like that. Let us not be the newspaper first headline. Let us look into the challenges, erase the challenges, and hold the hands of the last person in the last village, in the last district of Nagaland for giving health care. Thank you.
It's lost, it's there in the cupboard, it got spoiled, it got misplaced. But if you have a digital platform, then everything's going to be there in your phone. So that's what exactly BDM, Ayushman Bharat Digital Mission, provides for the citizens. There are a few core building blocks. Those are ABHA, Ayushman Bharat Health Account ID, which gives you a personal ID, your health account ID. And then the next one is the HPR, which is the Health Professional Registry, which registers all the doctors, nurses, the pharmacies, and all the healthcare professionals. Then the third one is the HFR, which is the Health Facility Registry, which these are the hospitals, the pharmacies. So everything is getting registered in the digital ecosystem of ABDM. Then we also have the drug registry and the software which we use for the patients, the hospitals, your health records, everything that comes under HMIS or whatever you call it, different names, HIS, HMIS, Hospital Management Information System, Health Hospital Information System. So all these things are linked together. Now, the whole process is digitalizing the health ecosystem of the country. First, as a patient, as a citizen, you will have your ABHA card in your mobile phone, which can be which is downloadable from Google Store or iOS Store. So you can search for ABHA, you will get a ABHA this thing. You download it, you get registered, you get e-verified, e-KYC done by your Aadhaar number. So if you have your Aadhaar number and your mobile number linked, it's very simple. You just go download the ABHA app, register through your Aadhaar number, OTP comes to your phone, you get registered, then you go to ABHA number, which is unique for every citizen. Now under an ABHA, you can probably have more than 1, 2, 3 ABHA addresses where you can store your medical records, like your dental records, your blood sugar records, or maybe any other, for women, other records you want to save it. You can save it under separate ABHA addresses. Now, the doctors, nurses, everybody will get registered in the HPR, which is the Health Professional Registry under ABDM. Then you can display your name, your phone numbers, your location, things like that, so that the patient can search for you. Now, in a hospital, the hospital needs to get registered in the HFR, the Health Facility Registry, so that that hospital is also visible. The doctors and nurses working in that hospitals are also all linked and registered. And the hospital, it's very important that the hospital should have a HMIS, which is ABDM enabled. There are so many softwares available in the market. So if you simply come with a software and you use your OPD, your billing and everything, but if it's not ABDM enabled, then these linkages between the ABHA citizen, the doctor and the hospital, those things will not work. So we have already started in Nagaland in 2023, and the country is already in the third year, and we have registered about a little more than 7.4 lakhs ABHA addresses. We have registered all the government hospitals 100%, and the doctors and nurses registrations are in progress. And also we are trying to bring in the private players, so that's why we have a microsite, very term microsite program, which we are doing in Dimapur. We are gathering all the private hospitals, doctors, we are getting them into the ABDM ecosystem. So I look forward to each one of you who have not registered in the ABDM, which is Ayushman Bharat Digital Mission. You can go to Google Play Store, iOS Play Store, and then download the my app, get yourself registered. Doctors and nurses, I would also request you to get registered and then be part of the digital health ecosystem of the state and the country. Thank you.
Progressive country, it will not become a developed country. Today you have islands of excellence, Delhi, Bombay, but that's not going to make entire India. Now all of us are talking about digitization. I'll keep my presentation short because CSR has to go. Couple of things in digitization that we must understand is that the backbone of connectivity is good telecom network. Before we even put the first building block of any IT initiative, we must ensure that the last mile connectivity, which I presume that in this case would be Village Tribal Council, what is the kind of accessibility and the quality and the consistency of speed of internet connection that I have it. So I will suggest that you map the entire state, find out the gaps, and then we start interviewing. We do vice versa. We start doing it, then we find the problems. And we'll always have some locations which we can never cover by wired connectivity because of landslides. You have one in Sikkim, one rupture of optic fiber during landslide season every year, and half of Sikkim goes down. There we should go for LEO satellite connectivity, which is now a reality. We work on this kind of technologies. So we have a wired and we have a wireless network. The second thing is, which is very, very important, is in connectivity, we should also understand where is the problem, because you have, like for example, there is the internet connectivity in this particular hospital, but what is the quality of speed that I am getting, and why I am not getting that quality of speed is something we should understand. This is what it's called. I'll give you a very simple example, simplify this for you. In your 10th and 12th exam, when you go and try to access a server of CBSE or ICSE, most of the time it will crash. Because from across India, people are pinging one server in Delhi or Ajmer. It gets overheated and system crashes. Whether we talk about Aadhaar registration, we talk about e-Sanjeevani initiative, every time some kind of database will be uploaded against a particular person somewhere. This is what we call, so this is because you have to travel to one centralized location and ping that. System will never be successful on a heavy system because there's a bandwidth key, what we call splicing. Every optic fiber is spliced into 10, 100 highways. That is limitation. We can't have more people concurrently access that highway to get the data from that place. That is what NIC will not tell you what your service provider, because you will take a 1 gig. 1 gig is never a connection you will get. You get 1/10, 1/4. You have to understand how telecom communication happens between point to point. So in this we have come with a solution which is a CDN. So what's a CDN? Very simple thing. How many of you watch Netflix? Raise your hands. When a new series comes, how do you access so fast? They have what concept of edge servers. So let's say all of you doctors, you are accessing something on Saksham. Let's say I'm talking about anatomy classes. If you go currently and you access that class from there, every time you go and see the video, you are using the bandwidth, limited bandwidth of this college. So 100 students will access and your bandwidth will be finished. What you have paid for to the telecom company. But you are accessing the same data again and again. We have a CDN today. It's called content edge server. Moment I access data once, for example, if I pick up data from Delhi or Assam, here Saksham data and come to Nagaland, only for the first time it will download from the server. Second time to another time, the same data gets accessed by anybody, it's a local cache. So your main highway is free only for one-time data. This is how we should design the architecture of connectivity. Very, very important. I was today talking to Mr. Kali also about this, that when I came into the campus, I don't think you can digitally light up this campus because it's not structured the way. So we must understand how we design the telecom network for public infrastructure, whether we are connecting CS's office to district headquarters, to subdivision, to block, everything.
The better my road is, the better vehicles actually I can run. So that is how we look at it. And I'm happy actually that things are happening in Nagaland, and particularly in the field of health. In the last 4 or 5 years, a lot of things have happened. To some extent, we can say that fighting with COVID pandemic, that also gave an opportunity for the state to improve its health infrastructure. And a lot of funding has come into it. This medical college got started in 2023, and another medical college is being built in Mo. Then all our district hospitals and our PHCs, CHCs, they are being modernized, and medical equipment, etc., is being provided. We are, very eagerly waiting when you will come out of your degree, or the college. When will you complete your degree, so that you can immediately join the health infrastructure in Nagaland and then start providing services, because we are still deficient in the number of doctors, number of nurses, etc. So this is what it is. I compliment the director and her team for inviting MTron for conducting this workshop, because the young minds have to be constantly engaged with the newest things that are happening in the field, so that you are always abreast of the latest technology and latest happenings. We are talking of the SDG 2030 here. Now what does SDG 23 say? 2030? It says, among other things, ensure equitable, affordable and quality health care for all. Equitable, affordable and quality health care. Now, when we talk of affordability, the state government has done something in a limited way, I should say. In 2022, we started the Chief Minister's Health Insurance Scheme. So, health insurance scheme, this is a universal coverage, and I am happy to tell you that Nagaland is one of the few states in the country which is actually providing universal health care, universal health insurance for the entire population of the state. We are at present covering only the in-hospital care. The OPD care is not covered, but still hospital care, major illnesses, etc., these are the big drag on the pockets of the people, and we all know that in the absence of insurance, many people actually die because they can't afford the treatment. So affordability to some extent is being taken care of, but what about the availability? What about the access? Whether people are actually able to access it, whether we are actually able to provide it. So that is where this industry 4 products and services actually come into play. We talk of telemedicine, for example. I am sure you must have been taught about these things. Telemedicine is one concept, I should say, which can take care of the shortage of specialists, etc. in the state. You are sitting in, say, Pungro, PHC, and with the help of internet, robotics, you can actually perform that surgery which is critical to save the life of that patient. Similarly, at present, drone technology, for example, you take 1 day or 2 days to reach the medicines to a remote place by road. But if you do it by drone, it will take you half an hour or 1 hour at the most to reach the medicines. So those kinds of systems we can think about, and state government in a limited way is doing it, but a lot of work needs to be done. And we would actually be very happy if students can come forward, have small groups, and then you can also come up with many solutions. So think about it. Learning never stops. in the whole life, and we have to keep learning, otherwise, they say that it's a very competitive world. So even to remain in that place where you are at present, you have to keep running. If you stop, then you are going to get left behind. So never stop learning, and think creatively, critically, and that will give you a lot of insights and solutions. So with these very few words, I once again compliment the organizers for organizing this very important workshop, and I'm sure it will be very, very insightful and useful for the students also. And I hope that similar initiatives will be taken by the college to introduce the students to the newest technologies in various fields of medicine and healthcare. So thank you very much. God bless.